Gut makes us move. Gut makes us feel healthy. Gut makes us feel happy, feel satisfied, satiety, and it also makes us feel sad. Gut is an emotion because we have all have learned about the gut-brain barrier and all these things. Gut has a common connection with the brain. So I'm not going to deep into the anatomy or the physiological part, which I presume everybody knows it. Whatever we eat, if we eat a good food, yes, we all feel very happy. If the meal is not good, or if you have hunger, you get irritated, you get pissed off, mood off, whatever it is. So gut directly or makes us active, makes us inactive, makes us who we are. Yeah, that is one thing. Second thing is gut health or an impaired gut health leads to inflammation. Now, I will not say all inflammation is because of gut health or impaired gut health, but for all inflammation, gut is directly or indirectly responsible. Now, the common question arises because we are all physiotherapy experts, movement experts. किसी ने स्पोर्ट्स इंजरी पे गिरा एंकल पे चोट लगा inflammation हुआ how is gut responsible gut here in this scenario is responsible indirectly because any fall or injury or any inflammation happens due to collection of fluids where it comes take 2-3 glasses of normal water then lemon shot with a few grated ginger and slice of garlic half spoon of garlic. That's it. Warm lukewarm water, squeeze the lemon, add a few grated ginger pieces, cut a small garlic pieces, settle it, then drink it. Now, what it does is, once you start taking this, the body starts to energize. We are waking up from sleep. When you go to hotel or restaurant, the first thing what they ask, what do you want to drink? Now, the moment you drink something, the digestion fluid we have in our stomach is called HCl. It suppresses the HCl activity. You drink, let's say, mojito or a cocktail or whatever it is. You are voluntarily suppressing your HCl secretion or HCl activity. So, try not to drink anything at least 30 minutes before your food and at least 30 minutes after you eat. In between sipping of water is okay in case of any throat obstruction or something that is in the mouth. Yes, sip a little bit of water. So start inculcating this practice. Yeah. So now, what can a physiotherapist do to improve gut health? Because we are a movement expert, we all deal with exercises, we all deal with let's say strengthening exercises, breathing exercises, therapeutic exercises, whatever it is. Now, once you understood the gut, once you understand your patient's issues, whether it is inflammation, as you pointed out, colitis or IBS or whatever it is, everything hampers their mood. People may tell that I'm having a trapezius issue, I'm having a rotator cuff tendinitis. Again, tendinitis is inflammation. Inflammation begins in the gut. So please ask them what they eat. There is something called as 24-hour dietary recall questionnaire, which is in short what a person eats in a 24-hour cycle. You can just Google it, print it out, make a checklist of what the patient eats. Second thing you need to ask about is the sleep pattern. How good is his sleep? Do they compromise? Do they do this at home? Yes. 99% will say yes. So all these things impaired sleep, impaired diet uh, contributes to inflammation in the body. And as physiotherapists, when you start addressing these physiological deficits, automatically the treatment part will be better, the healing part will be better. Now let's jump on to the first part, which is what I'm going to talk about is holistic digestive well-being. The first thing is mechanical motility. So physical activity boosts the health. And then the manual therapy, abdominal, alleyway stroke, everything is clear. So what physical activity does is nothing but increases your mood, increases circulation. Once circulation increases, it increases in lymphatic drainage. Once lymphatic drainage increases, so automatically going to reduce the inflammation. Agree? Yeah. So what is this I love you massage? Nothing but heart shape massage. We massage the belly with oil, preferably castor oil, which is good, which is healthy, which is good for inflammation reduction. Now, diaphragm forms the core of the gut. See, the gut, which I explained, we have the stomach and all these intestine, everything is surrounded by what? Muscles. What are these muscles? Upper respiratory tract, we have the intercostal muscles, you have the pectoral muscles, you have the abdominal fibers of pectorals, rectus abdominis, and above all, you have the main fish called the diaphragm. Diaphragm is your what muscle? Chief respiratory muscle. It's responsible for inspiration. And what are the muscles responsible for expiration? It is your abdominals predominantly. If you have bad abdominal muscle or a pot belly, it means that their airway circulation is not proper, or the amount of carbon dioxide that needs to be exhaled per person is getting obstructed. So what we do, we train with breathing exercises. Why do we teach the patient to count or do the normal breathing when you say exercise? Okay, do this exercise, do this isometric exercise, be same as a manual. Yes, but ultimately you're making sure the patient has a decent amount of breath. Now remember this, please understand this. The body doesn't need pizza, body doesn't need pasta, body doesn't need Rajma chawal, body needs oxygen. How are our ancient sages survive in the forest? Just by breathing. They didn't have pizzas, they didn't have Coca-Colas. Body needs oxygen. Oxygen is your main fuel. All these food is going to supply you basic vitamins and minerals and macronutrients, which is used by the body as a fuel. That's it. So the more the oxygen is intake by the person or by the patient, the more healing happens. Why there is a recent study which says that cancer patients, those who are having this, what is it, radiation therapy or other therapies, you put them in a hyperbaric oxygen chamber. What happens when you put the patient in the hyperbaric chamber? Cell proliferation happens. New cells generate. So body needs oxygen. So how oxygen comes? The more we breathe them. Not like this. Not this. Do it slow. Do it relax. Hold your oxygen. The more you breathe in slowly, the more oxygen absorption happens in the body. Shall we try it once? Now please all of you sit straight. So just listen to me. We're just going to follow two steps. First step is I want you to feel your abdomen, which is like a balloon. Inhale through your nose, breathe out through your mouth. First, listen first. Listen first. While you inhale, the balloon should expand. The air should go in. Inhale maximum. Then breathe out slowly through your mouth and ensure that the balloon shrinks. Now do this just 2 repetitions. Then tell me at your own pace. Now for the second thing, once this 2 repetition is done, I want you all to inhale slowly as much as possible. Hold your breath as much as possible. Then breathe out slowly as much as possible. That's it. Inhale as much as possible. Hold that breath within you as much as possible. It can be 2 seconds, it can be 10 seconds, it can be 30 seconds, whichever you want. Then exhale slowly as much as possible. Now, once everybody done, just let me know. But just feel how energized you feel now. Just by breathing the oxygen slowly and retaining that oxygen within you energizes you. Yes? Agree? Now imagine once you repeat this daily. All it takes is less than a minute. You put your phone in charge, laptop in charging, vacuum cleaner in charging. Why don't you charge your own body? The body requires just oxygen. We exert ourselves daily 24 by 7. We go here, we go there, we compromise for the patient because of patient appointment. How many of you have skipped your lunch, dinner, everything? Many of us will have done. I have done it myself. I'm sorry, I'm taking it into your philosophy class, but that's the need of yeah. Recently, I happened to read an interview by Elon Musk, and I hope everybody agrees that nobody is busy in the whole world than that guy is. He runs four topmost companies in the world, which is Starlink, SpaceX, Tesla is there, and then this Twitter is there, then Neuralink, something is there. Now he's the busiest CEO in the whole world. Everybody agrees. The catchy point about this interview is he says that the way he lives his life is like a timetable. This is the time I'll wake up. This is the time I'll brush my teeth. This is the time I'll have my breakfast. Then this is the time I go to Tesla. This is the time I go to Starlink or any other company. This is my lunch time. This is my evening snack time. This is my sleep time. That's it. He schedules his daily life and he never compromises. If it is time for him to do a meeting, he does that exactly at that same point of time. If it is time for him to eat, he eats precisely at that time, no compromise. So it's a very simple thing to follow, difficult to say. But coming back, so the diaphragm and your intra-abdominal core pressure is your key point. And as physiotherapists, do you all agree? We all know how to tap the diaphragm. You all did that. You all practically did that. You tap your diaphragm so that it activates each and every corner of your body. So diaphragm is a jellyfish and it has tentacles spread all over your body. And these tentacles spread oxygen. That's it. Then comes your pelvic floor posture. And you don't have to detail much. Pelvic floor experts are there everywhere. And remember this, even male has a pelvic floor. Not the only the females has a pelvic floor, males has a pelvic floor. So try to work on the pelvic floor muscles, try to work on the diaphragm, try to work on the abdominals, but ensure that the exercise you give to your patient, you do it first. You learn it. You try it on yourself. It is like a nutrition class. We all teach the students to cook nutrition class. Just don't prescribe micronutrients, macronutrients, 1300 calories, 700 calories, carbohydrates around half protein 30%, carbohydrate 30%, no carbs. Cook it yourself. Cook it, learn it, how much time it takes for you to do it. So that you will understand when you prescribe it to your patient, you will prescribe it with your experience, just not with textbook knowledge. Similarly, do these exercises what you give to your patient. Jackie Chan does this. Jackie Chan has a very big stunt team, and he has this famous quote: "I never teach an technique or a fighting technique or a stunt which I cannot do on myself." Same thing. The last big one, autonomic nervous system. No, vagus nerve. Can you hear me now? what all organ it connects? It's brain, it connects your heart, it connects your gut. It almost runs from head to toe. And we all ignore that. We all think it is useless. Now that is your main connective system. That is your main track. That is your main electricity tube. The more you tap your vagus nerve, how you tap your vagus nerve? What you did is one thing, breathing technique. Second thing is your yoga. Third thing is meditation. Fourth important thing, sleep. The more you rest your body, minimum of 7 to 9 hours, your vagus nerve heals. Most of us restrict ourselves from sleeping. Most of us force ourselves to work more and more and more, compromising on our own health. Yes? Yeah. The more you rest, the more you heal yourself. So, now comes the logical question. My patient is a businessman who is busier than Ambani. How can I ask him to rest? Depends on your patient to listen or not. Yeah, we have to be practical. Because as physiotherapists, we are all here to learn, not only to do sacrifice or patient healthcare. We are all here to earn money. Yes, we need money to run our family, run our business, and run our personal life. So all we can do is go until a certain point to tell the patient, teach the patient, do this and do that. And the remaining thing, it is up to them to listen or not. Stress modulation. What it does is it reduces flight and fright. Again, the whole picture, if you see, everything corresponds to sleep, diet, gut health, reduce inflammation. Now, very recently, I learned that carbohydrates are being considered as non-essential diet. Why? Because the carbohydrate we eat today or generate today are refined. So the first and foremost enemy of our gut is refined sugar, refined oil, refined flour, which is maida. Now refined carbohydrates. So ensure the food we eat, the food we intake is proper, it is healthy, it is not refined, or at least start consuming less refined food. I'm open to any questions. You can share your personal issues, patient issues. We'll discuss upon it. Anybody? Maybe you all are activating with this now. No questions?
Condition what we said, irritable bowel syndrome. Do we have any specific thing besides the abdominal massage? I'm sure you said that irritable bowel syndrome.
Sir, whether it is irritable bowel syndrome, any other digestive issue like colitis, ulceritis, two things to consider is reduce in good gut bacteria, increase in inflammation. These are the top two contributing factors for any digestive tract issues. It can be IBS or any other issue. So the way to address this is reversible. Increase your good gut bacteria by taking probiotics. I'm using the word probiotic because prebiotic, there is something called as prebiotic and probiotic. Probiotic comes with your fermented food, fermented rice, fermented pineapple juice, or fermented stuff like kombucha, etc. Or kefir. These are all some probiotic rich foods. This is available, which you can make at your home. Now, prebiotic. Why I stress the word prebiotic is that prebiotic is like imagine you have a soil you have put the seeds and you spray nutrient-rich water. So you think that the nutrient-rich water is absorbed by the seed, so that the plant grows. Now, what it does is the nutrient-rich water you spray on your soil also feeds the microorganisms in the soil. It also feeds the remaining other small plants or weeds or whatever in the soil. So prebiotic acts as this fertilizer, which also helps the bad bacteria to grow. If you have more amount of, it is the ratio of good bacteria and bad bacteria. We have a bad breath because of increasing bad bacteria. So it reflects on your mouth, it reflects on your smell. So the prebiotic acts as a fertilizer. If it is absorbed more by the bad bacteria, ultimately the enemy chitin grows. So try avoid taking more of prebiotic, encourage more of probiotic, what to say, this fermented foods. That is one thing. Second thing is your reduction in inflammation. How inflammation reduces? Sleep, healthy food, exercises, simple massage technique. There is something called as castor oil compress. You apply castor oil, then you compress it with a bandage or even a simple cloth. Why? Castor oil has depth of penetration. It can penetrate deep. You have a calcaneal spur, apply castor oil. It will hit slowly. Don't expect the magic to work within a day. It will not happen because castor oil is something which has good inflammation healing properties and it has a very good depth of penetration. So increase the good bacteria, reduce inflammation is an answer.
Actually, my personal experience is too bad with this, what you call probiotic. The taste is too bad. Like you said, the apple cider or something, that fermented things. If you try to take with that sour taste, I'm not sure if everyone likes that. But otherwise, although they suggest you, but then even that Yakult or something, whatever you get, I'm not sure if the taste is too good.
That is the reason I use the word prepare it at your home. Fermented is something we have been using generation wise. Our grandmothers used it. Fermented rice water, fermented pineapple juice. Yes, curd, simple dahi, not the processed market wala curd.
Those increase of that, what you call visceral manipulation. Do you think there's any role for such kind of things?
So visceral manipulation, yes, it does has a role. Again, it depends on your country. It is condition specific. Sir. We cannot do it for all conditions, especially if you have a colitis or an ulceritis. Where again you're going to irritate the gut. The more you do manipulation, imagine you're applying any manipulation, you're applying a external force or external pressure. Let's say pressure is measured in hertz. Some amount of hertz you're going to put in externally into the body. What is going to happen is that that particular area get vibrated. You do a manipulation technique for your shoulder or a knee. You're giving an external pressure so that it breaks your adhesion. Similarly, visceral manipulation is a technique to externally exert external pressure so that it increases the inflammation. So it increases the blood circulation, reduces the inflammation, increases the lymphatic drainage system. So remember this: blood is the only circulating system or the transporting system in the body. You take a tablet, you have a fever, you take a tablet, you have a headache, you take a tablet. So what this tablet does, the tablet or the medicine that the tablet has, capsule has, gets absorbed by the liver. So liver and kidneys are your main, what is it? I'll not use the word excretion. It's a cleaning organs. The food you eat, if it has more fat, it will absorb and stores it, glycogen, in the form of glycogen. So any medicine you take gets absorbed by the liver. Then the liver sends a signal. अरे मेरे पास ये medicine है, किसी को चाहिए. Brain will say I have a headache, send it. Knee will say I have pain here. It sends that. So blood is your only transporting system in the body. Yes, I agree. Lymphatic system is also a transporting system in the body, but lymphatic system gets activated only through movement. The more you sit, the more resting, the more rusting you are. So in order to pick up your lymphatic system, the simplest exercise is rebounding. Just rebound on your toes 30 seconds. It will activate your lymphatic system. The more you move yourself. That is why we are all called as what? Movement experts. So I've given you enough inputs. So I know that I haven't highlighted any particular issue or particular topic or condition. So I just wanted to talk in general about what is better, how physiotherapists can tap this market. I use the word market, yes. As students especially, you need to understand what is in future. Today we are in an AI generation. Use it wisely, improve yourself. Thank you so much. Any questions? Yes.
I would like to call upon Ritija to proceed with vote of thanks.
On behalf of the Maharashtra Institute of Physiotherapy, I extend my heartfelt gratitude to Dr.Sai Kishore sir for delivering such insightful and inspiring lecture today. Your vast experience in sports physiotherapy, research and global health promotion has truly enriched our understanding and motivated all of us. We sincerely thank you for sharing your valuable knowledge, real world experiences, and research perspectives with such clarity and passion. The session was both educational and thought provoking, and it will certainly leave a lasting impact on our student and faculty members. I would also like to thank our principal, faculty members, and all the participants for their active involvement and support, which made this session a great success. Thank you, everyone. Thank you.
Yeah, sorry for this. If you were happy, this chatting will be there. Thank you.